Botox as treatment for hyperhidrosis. Some people sweat when it's hot, and that's normal. But some people sweat consistently, hands dripping, shirts soaked, deodorant useless, not nervous, not overweight, not overheated, yet they are told it's anxiety. Just relax. It's in your head. That explanation does not match biology. Today we are talking about hyperhidrosis and why Botox can be legitimate medical treatment. People believe excessive sweating means anxiety, poor hygiene, or heat. Sweating is treated as a emotional or cosmetic instead of a nerve signal disorder. Patient pays the price. Patients embarrassed, symptoms dismissed, years of ineffective products, delayed diagnosis. Here is the truth. Hyperhidrosis is not excessive sweat, it's excess nerve signaling. And this is what happens in real life. Sweating is controlled by the, call it, autonomic nervous system. You don't choose to sweat. Nerves release a chemical messenger, acetylcholine, that activates sweat glands. Sweat is automatic and voluntary, neurological, not emotional. So what hyperhidrosis actually means? Hyperhidrosis doesn't mean the sweat glands are broken. The glands are normal. The temperature is normal. The problem is the signal. The nerves fire too often like a light switch stuck halfway on. Common areas: under arms, palms, soles, scalp, face, and often starts in childhood or adolescence. It's symmetrical and occurs without heat or exertion. And there are two types actually of hyperhidrosis: the primary one and the secondary. The primary one, there is no underlying disease. It's a genetic tendency, nerve overactivity. For the secondary hyperhidrosis, either thyroid problem, infections, menopause, medication, cancer, or systemic illness. I want you to know this: Botox treats only the primary hyperhidrosis, not sweating caused by medical illness. This is critical. So why deodorant fails? Deodorant treats odor, antiperspirant blocks pores, and neither turns off the nerve signals. That's why patient says, I tried everything. Most of the time they have. So how hyperhidrosis is diagnosed? The diagnosis is clinical, no test that you need to do, just talk to the patient. Doctors look for symmetrical sweating, early onset, no fever or illness, sweating even at rest or sleep. Anxiety does not sweat while sleeping, nerves do. So for the treatment, there is the ladder. And Botox is usually not the first line, actually it's the last one. Treatment often progresses through prescription antiperspirant, topical glycopyrrolate, oral anticholinergics, what you call the other, ionotrophoresis, excuse the pronunciation, then Botox. This shows responsible medicine. And so what Botox actually does? Botox does not treat sweat glands. It blocks the nerve signals. No signal, no sweat. The gland stays healthy. This is neurology, not cosmetics. So if you decide to go for Botox, what the procedure is like? Multiple tiny injections. They are superficial skin depth, 15 to 30 minute total. Ice on or numbing medication are used. The result, improvement in 3 to 7 days. Peaks and 2 weeks. Lasts for 4 to 7 months, and typically reduction 70 to 90% less sweating. So let me go over common fears. Will the patient overheat? The answer is no. Million of sweat glands still there, remain active. Is this permanent? No, it's reversible, the treatment. Is it cosmetic? No, FDA approved medication, but you need medical indication. Is it is covered by the insurance? Yes, but you have to show that's the medical indication. Surgery is a big deal. Botox is temporary and localized. Surgery, we call it sympathectomy, it's permanent, alters nerve pathway, and may cause compensatory sweating. So it has its own complication and morbidity. Botox is safer and reversible. So hyperhidrosis is not life-threatening, but it is life-limiting. Handshakes avoided, clothes ruined, jobs affected, confidence damaged. This matter a lot. Remember this. Botox does not stop sweating. It stops abnormal nerve signaling. If sweating controls your life, you're not broken. Your nerve system is overfiring, and sometimes the solution isn't a stronger deodorant. It's correcting the signal. This is Dr. Ben Mamer. If you think that healthcare needs to be changed in America, hit follow.